My name is Kitten. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफी फर्क आ रहा है.
Okay. I actually had this surgery in the back and voice.
You said I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Shiraldin.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
Treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, Voice Therapist. And my name is Sanjay Kumar. By profession, I am a speech language pathologist and audiologist. And I have studied from AIIMS Delhi, All India Institute of Medical Science, New Delhi. I did my graduation in the speech and hearing science. Post-graduation, I did in speech language pathology from the University of Mysore. And today we are live with Krishna after treatment. And we did his pre-treatment live on 24th of May 2021. And today date is 1st June 2021. So Krishna, I want you to speak. How was the experience and what problem you had earlier? And now how do you feel? What are the reactions of your friends are coming? Just tell about that.
Thank you, sir. My name is Krishna. I'm 28 years old. I'm from Kerala. So the issue I was facing was having this high-pitched voice from my childhood days itself. So you can say like my voice never really changed during puberty, and I like continued speaking in that high-pitched, feminine, childlike voice for a long time. So the issue I was facing was that people often mistook me for a woman or a child. If someone calls me, some stranger calls me, they call me madam, like that. And also like due to that high-pitched voice, I lacked confidence when it comes to public speaking, like doing some seminars in college, giving some presentations in my like office meetings, like that. Also, it was tough for me to talk to new people because I always like be reluctant when it comes to meeting new people and contacting new people, like that. So I always had a comfort zone, so I only used to talk with my friends and all. It was like that. And yeah, my also the loudness of my voice was also a bit lower. So only people who are like just in front of me could properly hear what I'm saying. So even then, people will ask me, "Can you talk a bit louder? What you told was not clear," like that. Yeah. So that was the main issue I was facing with my voice. Yeah.
Okay. So when we started the therapy, and what are the reactions of your friends and the family members are coming now when you're calling on the phone, especially?
Yeah. Actually, when I'm calling my friends, no one is believing that it's me who is calling them. So they're asking me like, okay, someone else is using your phone to prank us, or maybe you are using some like voice changing apps, like that. So no one could actually believe me that it's me speaking in this voice. So then I told, no, it's changed. It's like this now. And then they told, okay, it's nice. It's feeling better. it sounds better than your old voice. So yeah, you should continue speaking in this voice moving ahead. But still, many friends didn't still yet believe me. So they were thinking I'm doing some kind of a prank with the voice. So yeah, I guess I need to meet them in person for them to believe. And I couldn't blame them, because even I couldn't believe that my voice is like becoming this low pitch with such a short period of time. So yeah, it feels great. It feels like very great. Even my parents, my sisters, all are like very happy, and like they are feeling, yeah, it's good, your voice changed, it's nice, like that. Yeah.
So do you remember when we started the treatment, when we did the pre-treatment live?
Yes, it was on 24th May 2021. Yeah, so I think making that call to you that previous day, I think that might be the best decision I might have taken in my life. I could say that, because from that moment, I guess I got some confidence that my voice will be changed. And now, when the first day I called to sir, like he told me, don't worry, I will treat you. I will change your voice. I will make it low pitch. And yeah, here we are, I guess, like after 8 days, the voice has changed like dramatically, you could say. And it's a great feeling. It feels very good listening to your voice having this low pitch. Like after like 28 years speaking in an high pitch voice, and suddenly after 8 days, seeing this much difference is it's a great thing for me. Yeah.
So what are your profession? What work you do? Where you stay? What work you do?
I'm an electronics engineer. I work in Hyderabad for an MNC. But currently it's all work from home, so I work from my hometown, Kerala. Since it's all work from home, there is like a lot of online meeting and calls on going on. Yeah, so even in my office meetings as well, I tried speaking in this low pitch voice, and even my like colleagues were all surprised and asking me, okay, is it Krishna talking or someone else? Yeah, so I told you it's me. It's the same me, but with a different voice. Yeah, so I guess and that felt great, because I thought it was initially tough to speak to the colleagues in this voice, because friends and families, you are more comfortable, you could adjust and talk in this voice. But even colleagues, with colleagues as well, I could talk freely. Even with my manager as well, I was able to talk in this low pitch voice. So yeah, even like everyone is like surprised, but not yet fully believed that the voice changed. So yeah, but it feels great to me. Yeah.
So I'll little bit speak in Hindi also, because many of my YouTube channel viewers are Hindi, Hindi speaker and Hindi understanding people. So नमस्कार दोस्तों, हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पे आप सभी का स्वागत है। और हमारे साथ हैं कृष्णा की आवाज़ जो थी वो पतली थी, हाई पिच थी, फेमिनाइन वॉइस थी, बच्चों जैसी वॉइस थी। और हमने इनका ट्रीटमेंट स्टार्ट किया था, असेसमेंट किया था 24 मई 2021 को। और आज हम लोग ट्रीटमेंट के बाद लाइव हो रहे हैं, तो आप उनकी वॉइस को सुन पा रहे होंगे। थोड़ी कृष्णा की जो हिंदी पुअर है, तो हम लोग हिंदी में बात नहीं कर पाएंगे कृष्णा से, लेकिन आवाज़ सुन के कंपेयर कीजिए। और जो लोग इस लाइव को देख रहे हैं, मैं उनको बताना चाहूँगा कि 24 मई का जो हमने लाइव किया था, उसका लिंक हमने इस लाइव के डिस्क्रिप्शन में डाल दिया है, तो उसको भी ज़रूर देखिए। और आप लोगों को सच में इनके वॉइस में चेंज दिखती है, तो आप लोग हमारे यूट्यूब चैनल को सब्सक्राइब कीजिए, लाइक कीजिए, शेयर कीजिए। और मैं उस लाइव का जो है वॉइस कैसी थी एक बार मैं प्ले करूँगा। नाउ आई एम गोइंग टू प्ले द हाउ द ऑन द 24 मई 2021 कृष्णा's voice was. So just I'm going to play that voice, how it was. So this was your voice on 24th May 2021 when did live. So I'm going to play this.
Yeah, thank you, sir. So my name is Krishna. I'm 28 years old. I'm from Kerala. So the issue I'm facing is having this high pitch voice. So my voice has been like this even from my childhood days, as Sarah has already mentioned. So my voice never really changed over the period of time. So that's the major issue that I face with my voice.
So this was your pre-treatment live, and now again let's continue our conversation. Yeah. So I just played how the voice was earlier before treatment. So you can just listen, and even you can go to the detail. Those who are watching this live, after clicking the link of which we have given in the description of this live. And yeah, let me see if any questions will be coming. I'll be also discussing on those. I think already. Sorry. Yeah, few people has joined. They are saying hi. Adarsh Misra is saying, Sanjay sir, good evening. Good evening, Adarsh Misra ji. And Bhojraj is saying hello. Hello, Bhojraj. And Narwali Singh is saying hello. Hello, Narwali Singh. So thank you everyone for joining us and watching us. And my request is, if you can see the Krishna's pre and post voice change, means before treatment how the voice was and after treatment how the voice is. तो ट्रीटमेंट से पहले कृष्णा की वॉइस कैसी थी और ट्रीटमेंट के बाद कैसी है, दोनों में अगर आपको डिफरेंस दिख रहा है तो प्लीज़ हमारे यूट्यूब चैनल को सब्सक्राइब कीजिए, लाइक कीजिए, शेयर कीजिए, ताकि कृष्णा जैसे वॉइस की समस्या से जो फेस करने वाले लोग हैं उन तक ये बात पहुंचे कि इस प्रॉब्लम का सॉल्यूशन है और वो लोग भी सॉल्यूशन तक पहुंच सकें, सही जगह पे पहुंच सके। और हमारे बारे में ज़्यादा जानकारी मिल सकती है हमारे वेबसाइट पे www.speechtherapyindia.in। तो हमारे क्लिनिक में जो सबसे ज़्यादा कॉमन क्लिनिक में कह सकते हैं या हमारे यूट्यूब चैनल के कमेंट बॉक्स में सबसे कॉमन क्वेश्चंस आते हैं, सर आपका एड्रेस कहाँ है, नंबर 1, और लोग बताएंगे XYZ प्रॉब्लम है और ट्रीटमेंट ड्यूरेशन क्या होगा, ट्रीटमेंट कॉस्ट क्या होगा। तो पहली बात है कि अगर आप हमारे वेबसाइट पे जाते हैं, हमारे वेबसाइट www.speechtherapyindia.in क्लिक करते हैं रीच मी, तो आपको हमारा ईमेल आईडी दिखेगा, हमारा कॉन्टैक्ट नंबर दिखेगा और गूगल मैप पे हमारा क्लिनिक कहाँ पे सिचुएटेड है वो भी दिखेगा। और फिर हमारा ईमेल आईडी भी दिखेगा, तो आप हमें ईमेल कर सकते हैं, कॉल कर सकते हैं। अभी चूँकि कोविड की वजह से क्लिनिक बंद है तो हम लोग लैंडलाइन पे रिसीव नहीं कर पा रहे हैं कॉल। मोस्ट प्रॉब्ली 6-7 को जब ये खुलेगा क्लिनिक तो हम लोग रिसीव कर पाएंगे लैंडलाइन पे। तो आप हमें मेल कर सकते हैं और अपना कॉन्टैक्ट नंबर मेल के माध्यम से छोड़ सकते हैं, तो हम लोग आपसे कॉन्टैक्ट करेंगे। और हमारे बारे में ज़्यादा जानकारी मिल सकती है हमारे वेबसाइट पे www.speechtherapyindia.in। So those who are watching this live, if you are feeling there is a pre and post changes after the voice therapy, online voice therapy, so please subscribe our YouTube channel, share this video so that people like having similar problem can get to right solution and can reach to a right professional like us. So thank you everyone for joining us and watching us, and I'll be discussing the question. If you have any question you can ask. Yeah, and Pranav Das is saying hello sir, hello Pranav, hello everyone. And दूसरा जो क्वेश्चन आता है, the common question is what will be the cost and the duration of treatment. So people will be saying that, mostly I've seen that, sir, I have a hoarse voice, how much time it will take to correct it and how much duration of treatment will be. So the reason of a hoarse voice can be vocal nodule, vocal polyp, even the vocal cord paralysis, even in the Puberphonia also I have seen that, and even muscle tension dysphonia. So first we need to understand what could be the reason of the hoarse voice. So the first suggestion is please call us. We'll try to understand your voice after listening. We'll do the perceptual evaluation, and if needed we may suggest stroboscopy or laryngoscopy or any other test. So after combining all the information, we'll be able to comment on the issues like what will be the duration, what will be the treatment cost, online or offline. So we'll be able to guide you better. So please call us if you have any communication problem, and after the perceptual evaluation we'll be guiding you. And for all the communication disorder, we don't suggest stroboscopy and laryngoscopy. So after the perceptual evaluation, we decide this can be a client for the stroboscopy, or this can be a client for the laryngoscopy, or he may not require. So this is my suggestion. And any of our YouTube channel's video, if you'll go explore the description, you will find our contact details. So जब भी हमारे YouTube चैनल के किसी भी वीडियो के डिस्क्रिप्शन में जाएंगे तो हमारा कॉन्टैक्ट डिटेल्स भी मिल जाएगा। और जो क्वेश्चंस हैं हम उस पर आते हैं। Pranav Das is writing, you are great sir, thanks Pranav for your love. I am not a great person, but whatever I have learned, I'm just trying to help people with those knowledge. And I have one passion to treat voice problem. So that is the difference between me and other therapists. So I love to give the voice therapy. I love to treat the voice problem. So that is the passion. Not I'm a professional. Only the passion and the profession both are combined. So
But sir, like, sorry to interrupt, but for people like me, you are really great, sir, because that change, it's like amazing. It's like magic that's been happening to me because like 28 years you have been speaking in that high pitch voice, and suddenly, like after approaching you, it changed tremendously well. So uh, not just for me, I've seen like a lot of videos in your channel. So that's how I actually gained the confidence that even if I approached you, my voice will also be changing like those guys. Because when listening to that pre-therapy video, they all sounded like me. They also faced the similar issues that I faced due to the voice. And after the treatment, that change was like amazing for them. So I thought, yeah, I will call sir and take the treatment and get better. So, as I said, like before, the day I took the decision to call SAR was might be the one of the best decisions I have made in my life. It's not that the voice that changed. My confidence levels have improved too much. I remember, like Sar was saying during my pre-therapy session, like you come to me to reduce your voice to a low pitch. That I will do. That's my job. I will do. But as part of that, I will give you a gift of confidence as well. So I still remember that sentence, and that's exactly what happened. Once the voice got changed, I'm just having a good outlook towards life as well, because even my friends were saying this same thing. Not just your voice has changed, but your attitude, the way you speak, your confidence has all changed with that voice. Yeah. So for us, sir, you are great. Just want to say that. Yeah. Thank you.
Yeah. Thanks, Krishna, for your love and the appreciation of my work. Thank you so much. And actually, being a speech language pathologist, when I was studying in AIIMS Delhi, and even after that, also when I did my post graduation from the University of Mysore in the speech language pathology field, when I was interacting with the many people, even there are some public figure, cricketer, even some of politician. When I was hearing their voice, I was seeing that they are high pitched voice, and I was confident I can help him them, but nobody was approaching. Then I thought there may be something awareness is lagging, so we have to reach to the common people. And for that, in 2010, I started my YouTube channel because this was the media what I was having, and I was seeing in some of the newspaper there was some surgery done for the pitch correction, and for that some press conference was done by the hospital, that particular hospital. And I was thinking that we can correct it more easily, and we are not able to reach to the common man, common people. So with the help of social media, I started doing this, and I'm happy. Nearly now near to the 10,000 now we are approaching the subscriber of our YouTube channel. So thank you everyone for your support and love. And now I'm able to reach the mass, and I'm giving the masses. And in 2013, I started my online voice therapy. So that was the first case. And after that, we have continued. And during the lockdown last year, I was mainly focusing on the online voice therapy to stop the spread of the COVID and Corona. And really, people gave a lot of love and faith on us, and we are able to treat so many patients during the lockdown also. So this is all about the faith and using the social media as a platform. So thanks for the people, those who are responsible for making this platform like social media. So, and let me see if any question I have, I'll be discussing with those questions. And yeah, one most important thing I want to share to the people, like many time I have observed, like many patient will be telling to me, those who are maybe 30 years, 40 years. So they'll be saying that I was informed that your age is very high, so you are not a suitable candidate for the voice therapy. So, but my experience is that even 55 years age patient also, I have seen in my clinic, 39 years also the patient, if you are giving the voice therapy and if his body is responding, it can be corrected. But I'm not telling all the patients will respond equally in the same manner. So if patient's body is responding, So of course, even 55 years, 39 years patient also can be corrected by the voice therapy, what I have observed. So it's nothing like that. If only the pubertal age is, then only the voice therapy will work. And if age is more, the voice therapy will not work. So first, my suggestion is that there is a question mark in this heading. We should go for the surgery or we should go for the voice therapy. So first you should try the voice therapy. When voice therapy doesn't work, then you can think about the surgery. That is my suggestion. And even after surgery also, you require the voice therapy. So why not you should try first voice therapy. And sometimes people think that voice therapy take more time. So that is also the reason many people earlier were preferring to go for the surgery. But lowest I have treated in my clinic in one day also, this pitch and loudness correction. Average is 8 days is very common. And of course, sometimes it's more. Health science is not like mathematics, 2 plus 2 is equal to 4. So sometimes I will be getting comment in my YouTube channel comment box, sir, how many days it will take to correct the high pitch voice, puberphonia and all. So I can say the average is 8 days, but in extreme case, low duration will be low also, less also, and higher also. So it's not like a health science is mathematics. Again, I will say 2 plus 2 is equal to 4 is not the health science. So many factors depend, like how much I have the knowledge and expertise, number one. Number two, how the patient's body is responding, and how much patient is having the faith and following the instruction. Because Krishna is sitting in his own place and I am sitting in Bangalore in my house. Okay, so why that Krishna was treated? Because he followed my instruction. And some patient will not be having faith on this speech science and online voice therapy. And if they don't have the faith, they will not follow the instruction. If they will not follow the instruction, how it will be corrected? So I have seen failure in those cases also. तो मैं ये कहना चाहूँगा कि कृष्णा जो है अपने घर पे बैठे हैं, मैं बैंगलोर में अपने घर में हूँ, और हम लोगों ने ऑनलाइन वॉइस थेरेपी के माध्यम से ठीक किया इस प्रॉब्लम को. क्यों ठीक किया? मैं तो कोई सर्जरी किया नहीं, मैंने कोई मेडिसिन नहीं दिया, मैंने उनके गले को टच भी नहीं किया. तो फिर ठीक कैसे हुआ? ठीक होने का माध्यम क्या था? माध्यम था हमारा इंस्ट्रक्शन. तो जिस भी पेशेंट को मेरे ऊपर भरोसा नहीं होगा, वो मेरे इंस्ट्रक्शन को फॉलो नहीं करेंगे, हमेशा डाउट की नज़र से देखेंगे. और जब इंस्ट्रक्शन फॉलो नहीं करेंगे तो फिर वो ट्रीटमेंट कैसे होगा? तो कई बार मेरे पास पेशेंट की मेल आते हैं, तो आई विल बी आस्किंग सर्टेन information like what is the age, sex, where you are situated, contact number, so that we can communicate more effectively. So the patient is saying that, sir, ये information ज़्यादा ज़रूरी है क्या? So I guess if the patient is not understanding the first instruction, then how it will be following the other instruction? So we try to just get an idea also with the patient behavior, who can be the गुड कैंडिडेट फॉर द ऑनलाइन वॉइस थेरेपी. जब मैंने मेल में कुछ क्वेश्चन पूछा तो उसमें आर्गुमेंट कर रहे हैं, तो मैं यहाँ पे बैठ करके उनको कैसे ठीक कर पाऊंगा? तो उसी समय में आइडिया मिल जाता है कि डिफ्रेंशिएट कर लेता हूँ कि अच्छा, दिस कैन बी द गुड कैंडिडेट, दिस कैन बी फॉर ऑफलाइन और दिस कैन बी ऑनलाइन. तो फर्स्ट क्राइटेरिया है कि पेशेंट हमारे इंस्ट्रक्शन को फॉलो करते हैं कि नहीं. और जब पहली बार वो कॉल करते हैं और जब हम फ़ोन पे बात करते हैं, या फिर जब वो मेल करते हैं, मेल में हम कुछ क्वेश्चन पूछते हैं, अगर उसका प्रॉपर आंसर देते हैं तो हमें पता चल जाता है कि आगे भी भविष्य में वो लोग इंस्ट्रक्शन को फॉलो करेंगे. तो ये भी एक तरीका है पता करने का कि कौन से पेशेंट राइट कैंडिडेट हैं ऑनलाइन के और कौन सा ऑफलाइन के. और तो कृष्णा के साथ मैंने बहुत इंजॉय किया. आई एंजॉयड विद द कृष्णा. Whatever the instruction I was giving, with the complete faith he was following, and that's why we have corrected. Even his treatment was 1 or 2 days before only we corrected, but we are becoming live because yesterday I was live with other patient and I was busy, and even I wanted more confidence on the Krishna's face. So today I felt that he's very confident that we made it live. But I think pitch correction was done 2 days before only, I think. Is it Krishna?
Yes, sir. Yes. Like 2 days back itself, I was able to like talk in this pitch. Yeah. Even as you said, like even like I was not aware like this is something that can be cured, because I always thought everyone has like their own voice, and mine was like a bit higher pitch, and it will be like that forever. So I never knew that this is something that can be cured with therapy. I thought maybe a surgery or like some medications might help. Yeah, but then very recently I came to know about this condition called puberphonia. So then after searching in YouTube, then I came across your videos, and also then I could like relate with other patients as well. So they were also speaking in that high pitch voice like me, and after the therapy their voice changed. So I thought like what's the harm? I could give it a try because it's not a surgery or anything else. It's not even like it's not like physically not even meeting you. It's just online. So it was like a really good experience for me, like to seeing my like voice change over the days, like that felt like really great. So yeah.
Yeah. Yeah, so even for me also it was very interesting while working with you. Whatever the instruction I was giving, you are following, and that's why the therapy works very effectively and very nicely. So thank you for your faith on us even, and let me see if any questions are having. Yeah, one thing I want to add here, many patient uh, like go to the some like healthcare quacks thinking that they are the right professional and they are a speech therapist. So and once they will come to us, and sometimes they will damage the vocal cord and the voice. So whenever you are trying to take the speech therapy, always try to get some information. That information is the speech therapist or speech pathologist, where he is working, which hospital and which clinic. Then try to find out if he is a real or fake, in which college he has studied, the college was affiliated by which university, which year he has graduation or post graduation. If he has the post graduation degree, he got, and if he is registered in the Rehabilitation Council of India or not. If he has registered, what is the registration number? These information are available on their website or in the social media page. If it is not available, so maybe your speech therapist or speech language pathologist may be fake. So this information you should inquire to save your vocal cord and the communication. Sometimes they may damage also the voice and the vocal cord. And if such thing happening, so you can report to the Rehabilitation Council of India (RCI), and they will take legal action for the healthcare quacks. So this is the information I wanted to share. तो मैं उन लोगों को बताना चाहूँगा कि जो लोग सिर्फ किसी का नाम देख करके कि स्पीच थेरेपिस्ट अपने नाम में लगा दिया और आप सोच लिया कि चलो ये भी एक स्पीच थेरेपिस्ट है, ऐसा नहीं है। कई बार बेरोजगारी की वजह से लोग झोला छाप स्पीच थेरेपिस्ट भी बन जाते हैं, जैसे झोला छाप डॉक्टर बनते हैं वैसे ही। और वो लोग क्या करेंगे, कई बार वॉइस और वोकल कॉर्ड्स को डैमेज भी कर सकते हैं। तो अगर ऐसे लोग जो है से थेरेपी लेना जो है हमेशा रिस्क से भरा हुआ है, और अगर ऐसे लोग आपको हानि पहुंचाते हैं, नुकसान पहुंचाते हैं, तो रिहैबिलिटेशन काउंसिल ऑफ इंडिया को रिपोर्ट कर सकते हैं, वो लीगल एक्शन लेगी। तो अगर आप रिहैबिलिटेशन काउंसिल ऑफ इंडिया के वेबसाइट पे जाएंगे, ईमेल आईडी उनका होगा, और उस पर आप रिपोर्ट कर सकते हैं कि ये जो है फेक स्पीच थेरेपिस्ट आपको किस तरह से नुकसान पहुंचाया। तो ये मैं बताना चाहूँगा। और जब भी कभी भी स्पीच थेरेपी लीजिए तो एक प्रोफेशनल्स लीजिए जिन्होंने इस फील्ड में पढ़ाई किया है और जिनके पास ग्रेजुएशन की एटलीस्ट मिनिमम डिग्री हो इंडिया में अगर है तो। और इंडिया से बाहर जैसे यूएस वगैरह में मिनिमम डिग्री जो चाहिए वो स्पीच लैंग्वेज पैथोलॉजी में मास्टर डिग्री चाहिए प्रैक्टिस करने के लिए, लेकिन इंडिया में ग्रेजुएशन से भी काम चल जाता है जो लोग काम करते हैं। तो प्रेफरेबली आप देख लीजिए कि अगर आपको पोस्ट ग्रेजुएशन वाले मिल जाए तो और भी अच्छा है, ना मिले तो एटलीस्ट ग्रेजुएशन की डिग्री हो स्पीच एंड हियरिंग साइंस में। और उनके कॉलेज का तो पक्का पता कीजिए कौन से कॉलेज से पढ़ाई किया है, वेबसाइट पे है कि नहीं है, सोशल मीडिया पेज पे है कि नहीं है, तो इससे भी पता चल जाएगा कि वो फेक है या असली है। तो ये सारी चीज़ें मैं बताना चाह रहा था, और मैं देखता हूँ कुछ क्वेश्चंस होंगे तो और उस पर भी हम लोग बातचीत जारी रखेंगे। तो जो लोग भी इस लाइव को, दोज आर वाचिंग दिस लाइव, अगेन आई वांट टू से थैंक यू एवरीवन फॉर वाचिंग। एंड देयर इज ए वन क्वेश्चन टू सर प्लीज़ होम भी बता दीजिए, हम भी बता दीजिए, कुछ समझ में नहीं है। ब्रिजेश इज राइटिंग टू सर प्लीज़ हम भी बता दीजिए। हमें पता नहीं चल पा रहा आपका क्वेश्चन क्या बताने के लिए आप कह रहे हैं। मैं सजेस्ट करूंगा कि आप हमें कॉल कीजिए, हम आपकी आवाज़ को सुनेंगे, समझेंगे, फिर गाइड कर पाएंगे। ब्रिजेश जी, और एक क्वेश्चन है श्रीधरन का। श्रीधरन लिखते हैं, हाय सर, आई हैव अ डाउट, आई एम हैविंग इश्यू विथ हाई पिच वॉइस, इफ़ यू गो थ्रू द ट्रीटमेंट will need the treatment that I have to speak to low pitch every time when I speak? Yeah, interesting question है। और मैं चाहूँगा कि कृष्णा भी इस पे थोड़ा सा बात करें, अपना अनुभव बताएं। हम लोग फोर्स नहीं करते, वी विल नॉट बी फोर्सिंग यू टू टॉक इन ए हाई पिच वॉइस और low pitch voice. Why the problem occurs, this kind of pitch issue? Because the vocal cord is not vibrating effectively. Why it is not vibrating effectively? During puberty, mass of the vocal cord, length of the vocal cord increases, and after that the pitch reduces, which happen in most of the people. But some people, because they are using the high pitch voice from childhood to puberty, so once during the puberty, mass of the vocal cord increases, length increases, so they will not able to switch on to the new voice. So what is happening, if this is the vocal cord, they will be vibrating only thin edges of the vocal cord. So in a very simple way, before puberty, vocal cord was like a thin string of a guitar, and after puberty it become thick string of a guitar, so the voice should come low pitch. So but because of their childhood habit, they will be using their high pitch voice, childish voice. So instead of vibrating the whole mass and the whole length of the vocal cord, they will be vibrating thin edges of the vocal cord, so the pitch will be higher. So what I will do as a voice therapist, I will stimulate whole mass and the whole length of the vocal cord. So once we stimulate whole mass and the whole length, the low pitch voice comes naturally. And we don't ask the patient forcefully to produce the low pitch voice. We ask the patient, whatever the voice is coming naturally, you should speak. So but during the voice therapy, once you stimulate the whole mass and the whole length, they will be able to produce the low pitch voice very, very naturally. So we are not going to teach the mimicry. We are asking the patient to talk at comfort level. So this, I hope I have answered your question. And Krishna, I think we have 5 minutes more. After that, my online therapy will start. So you also you can tell the experience. Are you putting effort, or you are speaking very naturally?
Yeah, I guess I asked this exact same question during the first session. Like, should I like try to speak in that low pitch continuously? Because even before the therapy, like when I take a deep breath and like I try to mimic that low pitch before as well. So I thought, I asked sir, like, should I do that? Should I like speak in that low pitch? Then sir told no. Like, we are not here to like, even I can speak in a high pitch voice and a low pitch voice, but that's not your natural voice. It's not like mimicry. You can speak in a low pitch voice. Then he said, like, yeah, never try to speak or force you to speak in a low pitch voice. We will do the therapy, and then whatever comes out of your mouth, just speak in that particular fashion. So that's what I did. I never really tried to force my voice out of my mouth. So like, as I said, like before, I could like speak in a low pitch voice, but that's for like a maximum of 1 minute or 2 minutes. After that, I will lose my breath. My voice will be cracking like that. But now I think since it's coming naturally, I can speak for like 1 hour, 2 hours without any cracking or loss of breath or anything. So then only I felt that, okay, this is actually natural. So that's why I'm able to comfortably speak in this voice than before, where maximum I could mimic it for like 1 minute. So yes, even I had that doubt, but I guess if you try to mimic, you won't be able to mimic it for more than a few minutes without losing your breath or anything, unless it comes naturally. Yeah.
And in this live, you are speaking continuously, so we can't do mimicry for the continuous so many minutes. So I hope I have given the answer. I think it was not. Just 1 minute. I think my mobile got stuck, so I am not able to read the question. So I'll try again. Yeah, so I hope we have given the answer for him. The question of Sridharan was a very nice question. And there is one more question. Is there any chance suddenly high pitch voice can come for a couple of words, or when speak in loud voice will high pitch comes again? See, for the different patient, the situation will be different. It varies. But one thing I want to say, if the voice therapy works, your body responds. So after therapy, the voice will be stable. So what I have observed in like maximum cases, I can say more than 99%. If the voice therapy respond, 100% is against the code of ethics. I'll not be using that word. Okay, so thank you everyone for joining us and asking such a nice question. And thanks Krishna for coming live. So we'll stop this live now. And I want to thank you everyone. So any message you have, Krishna, for those who are watching this live?
Yeah, thank you, sir. So anyone who's watching this live and facing similar issue as mine, like you might have seen the pre-therapy video. So if your voice is like a bit higher, or maybe like any other voice disorders as well, I would say like don't hesitate. Call sir, so he would guide you in the right direction because it's from my experience. Because even when I was seeing all those videos, I didn't fully believe. I thought it's like maybe 50-50, like someone worked, something didn't work. But until I experience it myself, so that's a great feeling. So yeah, so my suggestion is that like if you are facing this high pitch voice issue, I have been in your shoes and I got corrected, my voice got changed. So yeah, if you are seeing this and if you are facing the same problem, don't hesitate. Please contact Dr. Sanjay Kumar sir, and I'm very sure he will help you like he helped me.
Okay, thank you so much for recommendation. And time is now for my online voice therapy. So I'll stop this live. And thank you everyone for watching us. And I think, yeah, thank you so much everyone.